Alrighty, hey everyone. So I'm 5 months post-operation for MMA, maxillomandibular advancement for obstructive sleep apnea or double jaw surgery, and I feel better. I'm gonna get into that, but this video has been a bit of a long time coming because there's so many things I wanted to talk about, all the different consultations with all the different surgeons I had and all the different plans they gave me and all the conflicting opinions and information about how they do it, the risks and why I chose my surgeon and my plan, all that. There's a lot of good stuff to talk about. I think I got a little overwhelmed with it all, and so just to get the ball rolling again, I'm going to just be focusing on my experience in terms of the recovery, symptoms and things like that. So I'll first give you guys a good look at my new jaws. And I'll also put some before and after pictures up here for you to look at. And here's another before and after, which is my airway, scans of my airway. You could see the cross section is much wider in the post-op. And this scan was taken, I can't remember if it was 1 or 2 weeks post-op, so I need to get another one soon. Anyway, I am feeling better. I don't feel perfect, but there's definitely been an improvement. I mean, when I woke up on the operating table, I could just instantly feel that my airway was much wider. Before, I was able to just manually put my tongue back in my throat, and I could completely obstruct myself if I wanted to. This would happen a lot when I would go get consultations and people were, I don't know, whether I go to the dentist or orthodontist, I want to take pictures or take a filling or take a mold or whatever. So often those things were so difficult because there was so little space back here in my lingual posterior airway that just a little bit of the assistant or doctor asking me to push my tongue back meant I couldn't breathe at all. And now, no matter how far I put my tongue back, I can still breathe. So that tells you something. And then I've also been waking up a lot less, and I have been feeling more energy. So I've been exercising more, I've been back to skateboarding, I've been working more and just laying in bed a lot less, which is great. I definitely feel like I have my life back on some level. And I haven't used CPAP since the night before surgery. So it's a little bit difficult to compare exactly how much exactly how much MMA did, because on one hand, I'm not using CPAP, which should make my sleep apnea worse, but on the other hand, I had the jaw surgery, which makes my sleep apnea better. So it's not a fair comparison, but even with that being said, I am feeling better. But I still feel pretty tired. I still have symptoms, for sure. Now, depending on who your surgeon is and what they think, full recovery can take anywhere from I've heard 3 months, 6 months, I've heard 9 months, and I've heard 1 year. So I'm not yet at the 6-month mark. So I'm hoping that I'm not plateauing and that I'll continue to see more improvements. There might be a chance I'll have to get back on CPAP. Not really sure what the future looks like, but I'll talk about that later. And so overall, very happy, but it's not quite yet the end of my journey. So the recovery process was kind of shitty. I think for some people it's better and for some people it's worse, but it definitely made my sleep apnea worse, and it was pretty painful, and it's a highly invasive surgery. It's very unnatural. I mean, when I woke up, even just on my first night of recovery, just moving your jaws and your facial muscles, and it just feels like everything has just been moved into a place it shouldn't. And I think that the complication rate for these surgeries are very high, which will lead me into what have been my complications. So one of the things that people are most concerned about is permanent numbness. I have a lot of numbness here in my maxilla that's slowly going down. And from what I understand, numbness in the maxilla is almost always temporary, which is a good thing. It's the numbness on the lower jaw around the chin and the lips and and around the teeth and stuff that is a lot more permanent. And luckily, I have full feeling down there. So I think in terms of numbness, I'm going to be totally fine. The next consequence or adverse side effect that I have is pressure in my jaws. When you do a mandibular advancement, the more you pull it forward, the more pressure it puts on your jaws. And that was a big concern for me when I was going about my surgical plan. Why does it increase pressure on your jaws is a topic of a future video. It's a little bit complicated. I want to have some diagrams to explain how it works and take my time a little with it and how it relates to all the questions I had around my plan. But yeah, I have pressure, sometimes a bit of clicking. It doesn't really bother me, but I am concerned that long term it could turn into something worse. The last thing is that I have a tooth that has a lot of pain. And here's why I think it's happening, and a few of my doctors agree. I think it's just a traumatized tooth. It's the same tooth that my marpies were anchored onto, the arms of the marpie were anchored onto. And so I had the installation of 2 marpies, the expansion of 2 marpies, the removal of 2 marpies, all of which are pretty traumatizing to that tooth. I then got on Invisalign, then I had to go on to a permanent retainer for MMA. Then I had the MMA, then I went back to Invisalign, and I think that the tooth is just very traumatized. So hopefully it heals on its own. The scans don't really show anything, so I don't know, but there's a chance I might need a root canal in the future. I hope not. Alrighty, so another thing is that my nasal congestion has improved quite a bit. My daytime nasal congestion is good enough to the point that I almost never use nasal strips anymore, and that has been a long-term change. However, I still use them at night, and I still struggle with nasal congestion at night. It's still better than it was before, but the problem, I think, is that when I used to have nasal congestion, I would wake up and the CPAP couldn't prevent my apneas. And the same is true now, but even though the CPAP couldn't prevent my apneas, it seemed like it at least reduced their intensity. Because now I wake up less, but the times that I do wake up, it feels like the apnea seemed pretty severe. Just a huge headache and shortness of breath. I think that addressing my nasal congestion further is going to help me a lot. So, what else? I've been feeling a lot more confident. I think I like the way I look, although it's not a completely... MMA doesn't reverse the craniofacial dystrophy that, created my jaw abnormalities. It's not... My jaws now aren't the way they would be if I never had any of these issues. So I'm going to also have another video in the future talking about aesthetics, because what I believe is after going through this process, jaw surgery is not just a science but an art. I think it's a very difficult surgery to do with all the risks and how limited it is, and all the different ways you can move the jaws, and how all the things are up to interpretation to you and the eyes of your surgeon, and it's a lot. So I think that that's definitely worth talking about. It's really hard, I think, to balance everything together. And lastly, I'll talk about my next steps. So like I said, waiting is one of the steps. I've also, with my newfound energy, been doing more exercise and taking health into my hands and stuff, which I hope results in some good stuff. And then lastly, I am next week starting formal myofunctional therapy with a provider named Jocelyn Pacheco. I'm going to NorCal to do that. It's going to be, I believe, a 12-week program. And I hope that that has some benefits. I've done like informal myofunctional therapy in the past, and it did help me, especially with CPAP compliance. So I'm hoping that it can help me also just with general symptoms while I'm not using CPAP. So yeah, that's it. there are some good things that happened and hopefully more good things to come. And I will hopefully continue making more videos, not only about what I'm doing next, but all the smaller details of what I had done before, whether it be how I, thought about my surgical plan, risks, or even recovery tips, things like that. Oh, and I will leave you with this hilarious photo of my peak swelling on day 4 post-op. Alrighty, bye.